أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Today we're going to start our question and answers for 2009. Every year we get emails, we get fax, we get snail mails, phone calls, fax, whatever, questions coming from all over the world about medicine and Islam and different medical topics, Islamic topics. So I wait till I get 3 or 4 of them, and then we do a program on questions and answers. And today we're going to start our Q&A for 2009. So this is our first episode for this year. Q&A 2009. The first email is the email from Alim, which is here in the UAE. Assalamu alaikum, Dr. Bial. I'm looking forward to your talk at the Zaid House and wonder if you might bring insights into remedies of improving physical eyesight. I have read some prayer books regarding du'as to make, but I wonder if there might also be medical or prophetic remedies for improving waning eyesight. Shukran. Now this email came from an African-American sister who was in an Islamic training program for American Muslim women that was recently held here in the UAE. It was sponsored by the Zaid House for Islamic Culture in Al Ain under the auspices of the Crown Prince of Abu Dhabi, Sheikh Mohammed bin Zayed Al Nahyan. And I was one of the lecturers in that program, responsible for lectures in Islamic medicine. So what happened was, at the beginning of the program, they gave all the students my email address so they could email me questions beforehand, so that when I started giving the lectures, I could answer their questions at the end of the lectures. So this question has already been answered in the class for the person that sent this email. But it is a very good question, and I thought it might be good to talk about it on the air. Well, what about the points of eye problems and how to approach it? First of all, you must have a good eye exam by an ophthalmologist. Not the guys that make the glasses in the eye shops. I mean a certified MD ophthalmologist, a thorough eye exam to rule out cataracts, glaucoma, problems with your fundus, and so forth, retina problems, problems with the circulation in your blood, in your eye, and the arteries and capillaries. So first of all, you need a good diagnosis. So you always start with an ophthalmologist if you got any question about your eyes. Okay, now, if there's something that the ophthalmologist can treat, modern medicine has a lot of advances now in the treatment of glaucoma. We got laser surgery, which is very effective in the treatment of many diseases. Cataract removals now are very routine. The treatment of glaucoma now is very routine, found to be effective. So many different forms of treatment. They can even improve normal eyesight from laser surgery. So first of all, start with an eye doctor, not an optometrist. So start there. Then, if you find out that, okay, you don't have glaucoma, you don't have cataracts, you don't have anything that's medically, shall we say, emergency, or that requires medical treatment, and you want to just, strengthen your eyesight, okay, there are other things you can do. But that eye doctor is going to do another thing. He's going to do a physical exam, which includes a visual field exam to see how how is your vision forward, in the right, upper left corners, the lower right corners, all around. This is called visual fields. Sometimes people have a blind spot here. They look here, they have a blind spot there. They can't see something coming from there. So we want to make sure you don't have any blind spots. They'll check your pressure in your eye for glaucoma, and they'll examine the fundus of the eye for any serious eye diseases. Now, if you want to strengthen your eyesight, The most common thing is the beta carotenes, which are a class of antioxidants that we've talked about, extensively here on Medicine Islam and previous programs. For those of you that didn't catch those programs, beta carotenes are a group of antioxidants that come from things like carrots, mangoes, papayas, etc. And also, you can buy it as a vitamin supplement. But, we always knew as children, and even as a kid, I remember people, telling you, your mother, your grandmother, eat your carrots because it's good for your eyes. It's true. Carrots have beta carotene, but they have a low amount of it, okay? There's more beta carotene in some of your more exotic and tropical herbs and fruits, but beta carotene is present in carrots, and that's where the name carrot comes from. Okay, so anything that contains beta carotenes will help increase your eyesight. It will improve your eyesight. Hijama to the occipital lobe, which controls eyesight, should be done on a monthly basis if you have an eye problem. If you don't have an eye problem, you should have a hijama done to the occipital lobe, that's the back of the head, at least once a year. Now, it's a little tricky because your optic nerve crosses when it leaves your eyes. So your right eye is controlled by the left part of your brain, and your left eye is controlled by your right eye of the brain. So if you know specifically that you have weak vision in your left eye, you must get hijama to the right side of the occipital lobe. If you know that specifically you have weak vision in your right eye, you should get hijama to the left side of your occipital lobe. But to be safe, do both sides. That's what I do. Do both, not one. And hijama, usually they like to do bilateral hijama just to be safe. Now, as far as other natural things that you can take, goji berries, which are found in the Himalayan mountains, have been found to have a very high level of beta carotene. The ORAC measurements of antioxidant potential are on the level of 30,000, which is one of the highest and strongest antioxidants known to man. If the goji berries are from China, they're called wolfberries. If the goji berries are from Tibet and the Himalayan mountains, they're called goji berries. But the regular use of goji berries can greatly improve eyesight because it has a very high content of beta carotene. Now, what about eye infections? Sometimes you can get eye infections that don't respond to modern medicine. I've seen this happen before in India. One time I was in India, and a group of us from America were there, and we all got pus and infection coming from our eyes, and the eye drops, the antibiotics weren't working, the anti-inflammatories weren't working. What worked was honey, which is a sunnah. One drop of honey in the bottom of the eyelid of each eye is antiseptic and kills eye infections. So for eye infections, pure honey, just one drop in the sac of the eye, in the inferior sac of the eye, on a regular basis can cure eye infections. SubhanAllah. And it's a sunnah. The next email came from Brunei, and I was very happy because this is the first time I've ever received an email from Brunei. Salam, brother. I have been seeing a program on Sharjah TV through satellite TV. Dr. Bial, I have a problem with my backbone, especially L4 and L5, for the past couple of years. Actually, it all started when I was jogging in the past. I did jogging so much beyond my body's potential to bear the hardship that it affected my backbone. Now I can hardly stand still for more than a few minutes. Medicines such as Voltaren and painkillers help temporarily. I am using heat pads which contain methyl salicylate, which is aspirin, camphor, capsicum. This heat pad plaster is called red chili plaster from Korea. I've also used it for about 4 years on the back and my lower back when I feel pain. And the pain diminishes for a while, but the pain comes back once the heat wears off, and that lasts for about a duration of 5 hours. after using it. Also, there's a heat plaster from Pakistan that I use called Paragon, and it contains capsaicin, about 1.5%. All of these plasters help, but I feel different using them. You know, that is, when red chili, I feel excessive heat, which helps me to do tasks which I would normally take more time. I don't feel tired when I'm using the pads, and also it helps me to be more strong. However, I have mixed feelings about all of this, because my problem is that I can't live my life